Well, many provinces in the country are bracing themselves for what is expected to be a peak in COVID-19 cases in some of the identified provinces, including Gauteng. And that's exactly where we are today in Soshanguve with the MEC of Health, MEC Bandile Masuku, who is just volunteering. He does do that each and every month. He goes to a health facility to lend a helping hand during these trying times. But of course, what we wanted to do was just to break away from the MEC very quickly, but speak to the health workers who are in the front lines, just to get a sense of how it has been, particularly working under the conditions of COVID-19. And we are joined by Malebe, did I say right, Sister Malebe, who's just going to give us that sense. But Mama, just take us through your confidence and tell us about the working conditions and how it's been working under COVID-19. Since
Soshanguve CHC is the only facility that delivers, has MOU, is the only MOU in Soshanguve, with quite a number of patients that are being delivered here. We are bombarded by neighboring locations that also come here. As the frontliners, we were very scared when we learned about this COVID-19. But as we are being briefed and we read according to the government protocols, we are forging ahead, trying our best to be on top of things. Even though sometimes we lack some PPE garments, we do try to use whatever we have as provided by our facility. The patient here, fortunately, we have not had a positive case from the patients, except from the staff as the frontliners. Though we have been tested, but we still have some who were quarantined.
And perhaps if I can just take me through that, because now you have some of your staff members that have tested positive, and you're saying that testing has taken place. But just, the anxieties around working during this time and actually having seen some of your colleagues test positive, just what that does to the stress that you already have of dealing with the job that you're supposed to do. But just take us into your head, around your headspace, in terms of what is it that goes through your head each and every day.
It is very stressful because some of the information we not get first-hand information from the seniors, because what we learn is after days that some of our colleagues has tested positive, but from our seniors we don't get this news. So we just learn from here and there that somebody has been put on quarantine, but we didn't know. That makes us very scared. Yeah, it frightens us, because if maybe we should have been told first-hand information that you must know that something like this has happened, then we brace ourselves for that. But if you learn it after 2 days, 3 days, when you see somebody is not on duty, later on you learn that this has happened, it is not right. It gets on our nerves.
And you do speak about the fact that the communication is the most important part of it. But take me into the fact that you have been working, I believe, for about 3 months under this particular COVID-19 pandemic. And one of the things I want to know from you firsthand is, what is it that you believe could help at this time? I know you mentioned the communication and the issue of PPEs, but what are the changes that you would call for to put your mind at ease, even if it's just for a little bit, but just to create an environment that you would feel safe in?
Okay, if maybe most of the PPE that we need is provided, we don't have to scrooge there and there. It will be better if maybe this facility is well well provided for. Even the working utensils are not that okay.
Okay. Thank you so much, Mama, for sharing with us that information, but certainly citing issues that are very much important in terms of the communication to the staff workers here, but more so the issue of PPEs, saying that it is something that's quite important to make one feel at ease, particularly those that are on the front line in battling this pandemic. But these are some of the issues that the Department of Health, not just in Gauteng, but in the country, will have to look at, particularly as some of those provinces prepare and brace themselves again to expect peaks in terms of the number of COVID-19 cases. We will, of course, be speaking to the MEC just to get a sense of what are some of the things that are being done to actually cater to some of those concerns.